Hello, this is Dr. Eric Lund, your Roseville neck and back pain relief chiropractor. In this video, I want to talk about a common postural or structural position that will cause lower back pain, and then an assessment that you can do, and then based off that assessment, a stretch that could help provide relief. So one of the things that can happen structurally is our pelvis can influence our lower back. And so in this video, what I want to talk about, which is the most common, is you get what's called an anterior pelvic tilt. And so that's kind of where your pelvis tilts forward. And so if I stand up here, if you tilt your pelvis forward, you can just feel that there's more pressure or stress on the lower back. So again, that pelvis has tilted forward. That's going to cause these joints in the lower back to compress. Okay, so an assessment that you can do if you have lower back pain is just compare these two positions. So the first one is simply laying down on your back, and you're gonna lay here for about 30 seconds, and then you would want to assess the level of discomfort in your lower back. Does laying down make it worse? If you do 0 to 10, 0 being no pain, 10 being horrible pain, just make a mental note of what level that pain is. Then the next position I want you to do is just to come up and bring your legs up and just kind of hold them like this. And again, you're going to hold that for 30 seconds. Does this make your lower back feel better? And then make a note of the pain level 0 to 10. Okay, now a very common cause of anterior pelvic tilt is tight hip flexor. So when you do that assessment, if your back feels tighter or more painful when you're lying flat, and then the pain becomes better when you bring your knees up, that's telling us that there could be anterior pelvic tilt, and it tells us that our hip flexors are tight, because that's the most common cause of what will tilt that pelvis forward, is when those hip flexors are tight. And so again, if it feels better with bringing the knees up versus when you're lying down, tight hip flexors are likely contributing to your lower back pain. So we just want to stretch those tight hip flexors out. And one of the simple ways we can do this is just with a lunge. So we get into this position, and then basically you stand up tall, and then it's like you're driving your pelvis into the ground. You'd hold that for about 20 seconds, and then again you can do the opposite side as well. But again, you've now assessed it with the test. We know then if lying down feels worse than with your knees up, we've got tight hip flexors. If we can loosen those tight hip flexors, we'll reduce the anterior pelvic tilt, leading to improvement in lower back pain. So do the assessment and then do the stretch, and hope it helps. Thanks for watching. This is Dr. Eric Lund, your Roseville neck and back pain relief chiropractor.